I just want to go through only the process of certification. Point number one, the certification is not done directly by the scheme owners, namely Quality Council of India or FRLHT. The scheme, the certification process is done by personal certifying bodies which are recognized by the Quality Council of India. The certifying bodies, there are certain requirements, prerequisites for them to be recognized as a professional certifying body. Once the certifying body is accepted, then they have to seek application from the traditional healers. To seek application from the traditional healers, they have to give a wider publicity that in the local language. That is very important so that the healer should know. And also, they should give wide publicity through the various Gram Vaidya Association. Though we call them as TCHPs, they are still Gram Vaidyas in most of the states. So, wider publicity needs to be given. And the structured application format and the prerequisite for application was mentioned by Dr. J. Roy and also is in the website of Quality Council of India under the TCHPS program. That application has to be filled. Their requirement is 18 years completed plus 10 years of clinical practice experience or service providing experience. It duly needs to be countersigned or validated by either the elected member or the administrative member when the Panchayat elections are not held. Since it has moved from Gram Vaidya to traditional community health care providers, they could be in villages or could be in towns and even in cities. So that is the difference when we shifted this to that. So that is the prerequisite to validate that they have to be certified by an elected member. The reason why an elected member is suggested is mainly because elected member lives within the community. An officer may be posted from outside. So it is mandatory for village administrative officers to live in the villages. Most of the time it's not the case. So the elected member is given preference to validate whether this person comes from a family of healers or whether he has learned in the Guru Satya Parambara or how long he has been practicing. All this needs to be certified only by a local authority, competent authority, an informal leader or a formal leader, elected representative. Once the certificate is received, if they fulfill the criteria of how many domains, like for example, common ailment, jaundice, both in how many domains they are applying, that has to be scrutinized, whether they fulfill the criteria of the age, whether they are practicing other systems of medicine, all those things have to be looked at, and whether they are being properly endorsed by the local panchayat has to be verified. Well, then the application has to be verified and communicated to them within a period of 15 days. And there is any lacuna in the application, they should be given 30 days time to refill the application and send it back. So they have to voluntarily go in for evaluation. So therefore they have to give an informed consent, because sometimes they feel that it's a family knowledge or the hereditary knowledge that they are exposing to the evaluators or the certifying bodies. So they should be doubly sure that no intellectual property is being stolen away from them. So the voluntary consent, this is a voluntary certification scheme. So they have to give a informed self-declaration that they are willing to reveal during the process of evaluation. They have to submit for evaluation within a period of 3 months from the application or once the application is approved. Who will evaluate them? That is the other critical point. This scheme provides an evaluator has to be minimum, initially we thought 50 years, but of late we find in most villages or more so in states of the Northeast region. Fortunately, I have been associated with the program in the Northeast with NICU University, which is the certifying body, or with Chhattisgarh, or with Karnataka, Kerala, and Tamil Nadu. So comparing all these states where I physically gone either as a assessor or an evaluator or a QG representative or just as a witness, we have realized this 50 years is little too long, and 20 years of practice with 18 years of adult age, that is 38 years is sufficient for an evaluator. The key information is that he should speak the language, he should know the vernacular terminology or the words which are used in that area. For example, if somebody from Karnataka comes to certify somebody in Tamil Nadu, they should know Tamil. It's also important, they should also know the vernacular name of the plants used, because when we say local community healthcare providers, we don't expect them to buy some branded medicine and prescribe. We expect them to collect herbs locally or grow herbs locally and use them. That is a way of sustainable utilization of natural resources, which is, and whether they maintain a herbal garden. I come to that part little later after the application. So these evaluators are carefully chosen, and for the two evaluators, there will be a team leader. The team leader will be a graduate or a postgraduate in one of the codified system of medicine of India, namely Siddha, Ayurveda, or Unani. So they will be the team leaders. But the team leaders will not actually function as evaluators. Only when there is a dispute between the two evaluators, they act as moderators. So the evaluation is actually done by experienced traditional community healthcare providers themselves. That is a very important feature that you should know. It's not an outsider, it is only from their own community that we have evaluators. And then there can be a public health expert who can be a witness to the evaluation process. This evaluation is generally done orally. Not all of them can read and write, but orally it's done. And most of the oral evaluation is videographed wherever it is possible. So for each of the domains, for example, common ailment, jaundice, bone setting, different set of evaluators in that particular domain is used. That is very important. So they should know the local language, they should be unbiased, they should not have any conflict of interest. If their children apply for certification, or if the Shishya apply for certification, in that particular panel, these evaluators cannot sit. So the conflict of interest between the evaluators and the evaluated person should also be revealed prior to the process of evaluation. Once the oral evaluation, the case presentation, the skill presentation is done in a common hall. Subsequent day with prior information, the evaluators visit each of these healers in their own place of practice, which is generally their homes. Because most practitioners, community healthcare providers, they serve the community from the farm or their home. Very few of them have some kind of a structured clinical facility. So they are visited there. The community is involved in the process of evaluation. We visually see whether they are using any modern medicine or any other medicines. We visually see whether they indulge in any publicity like activities. We ensure the community respects them. And if wherever possible, we interview few of the beneficiaries of the healer. And we also verify whether they are able to identify the herbs properly, whether the process of preparation of medicine, they are very clear, whether the dose of medicine, they are very clear, the duration of treatment, they are very clear, are they clear about the different types of treatment? I'll give you one example. I'll not take much of time. I know I am the last speaker of the day, so I will not take much of time. For example, in jaundice, there's an obstructive jaundice, there's an infective jaundice, and hemolytic jaundice. They need not have to know the jargons, the terminology, but they should know where is the risk factor. In bone setting, they should know whether they can handle the head injuries, the complicated fractures, the compound fractures, the commuted fractures, and the simple fracture. So these differences, these people should know. And the reduction immobilization. When they do reduction in immobilization, they are expected to know what kind of a spin to use, whether it's not sharp, whether it's not compress any nerve or blood vessel. All these things are being verified when they actually demonstrate this in the field condition. So all the knowledge, skill, and when it comes to some communicable disease like jaundice, whether they know how to prevent it, what causes it, what are the differences, subclassification, differential diagnosis, all these things an experienced healer will definitely know. So these are all included in the questionnaire, what we call as the minimum standard of competence. And their attitude, apart from knowledge, skill, cleanliness, how they maintain their background, all these things are verified, and also their attitude. How do they treat the patient? Because we know all of us, medical men take Hippocrates oath, the Voluntary oath, where we say that we will treat the other human being as our own. So that kind of an attitude, whether these people have, and though in most cases they do it free of charge, whether there is any exploitation in any form, which are all verified during the field visit, and then the evaluators recommend them to the certifying body. Certifying body consolidate the scores and choose the accreditation certifying committee, selects who are eligible, and then sends it to QCA, and QCA uploads in the website. The certifying bodies are also expected to maintain an independent website for this activity where all information are in public domain. There's also provision for appeal. If there's a conflict of interest, if somebody says that your evaluator was little biased towards me, there's an appeal committee, and the appeal committee goes through the process. Even for the certifying body, there's an appeal committee in the QCI, in the governing structure, there's a steering committee. All these things happen so that this certifying process is very elaborate, very stringent, at the same time not making the applicant uncomfortable. We have visited many of them in the location. After surveillance, post surveillance, after 1 year or 2 years, and we have also done the certifying bodies re-evaluation after 1 year, what we call the office assessment, then the witness assessment, and how they certify. As QCA representative have gone to these locations also, and I can assure you, because there is always the conflict between the graduate doctors and the traditional healers. How can you certify them? One thing I want to tell you is Government of India has started recognizing them, and that is why in the past 4-5 years, a good number of Padma Shri awards have been provided to some of the traditional healers from the Khanid tribes and other tribes in India. So therefore, the government recognizes them. Government recognizes their services in the rural community is very important. Even during the pandemic time, they are the torch bearers to convey the right information to the villages, because villages have a lot of respect for traditional community healthcare providers, and therefore they have a very significant role. And the process, like Dr. Anil Jori mentioned in the beginning, we have to have a good evaluation standard and also a good evaluation process and good evaluators. The 3 pillars are taken care of by the certifying body and also by QCA before certifying the certifying body. So this has been very successful in terms of this thing for the community, and the community gets benefited, the traditional community health healers get benefited. Even Ayurvedic doctors and Siddha doctors, we feel that these kind of people could be very efficient assistants in our own clinical practice. Thank you very much.